But I'm here with Ashley. She's about to do my Botox. So this is not actual Botox, so it's toxin. Jeuveau, but it's toxin.
Yes.
So
it's a neuromodulator.
And people, we can't see your face. So people confuse all Botox in one lump sum.
Right.
So that was an education for me.
Right. Botox. So there's 5. You're putting me on the spot.
It's okay.
Botox.
It's okay. You don't have to explain
Botox,
it, but
Xeomin, Jeuveau, Daxxify, and people have also heard of Dysport.
yes. And so she's using just a certain brand, so we'll just call it toxin.
Yes.
Yes. So it's kind of Botox for those that kind of don't know what it is. They all want to fall under that.
Right.
We can say Botox, but it's just a different brand.
Right.
Okay. All right. So I just want to clear that up because that was an education point for me.
So right now, if you wanted to pop a squat.
Yes, and I'm gonna move this a little bit. So this is my second time coming. So this is 2 months, 2.5 months.
2 months. So she's one of the maybe 10% that eat through tox like a monster.
Because
It's probably because she works out so much.
Mm-hmm.
So usually this toxin Jeuveau lasts people 3 to 4. If people are more muscular, work out more.
Yeah.
If they work out more, there's a lot of different reasons why you could eat through tox quicker. But she was like 2.5. She also has the strongest freaking forehead muscle ever. Look at this sucker. Like when we started, she actually didn't have this much movement, but I
had more movement. You mean I don't have as much movement now?
You don't have as much movement as she did before.
Yeah.
But she has a really super strong muscle, and so we're having to retreat. But what we're gonna do is,
and there was deep lines. So I'm coming in first time tox ever.
Right.
First time was last time. Almost. It was 2.5 months ago. And so I know there's some expectations. I don't expect to have a frozen forehead right away. I actually don't want a completely frozen forehead. And she knows that, so she's treating my whole face.
Right.
But so the expectation, so people kind of come in and you're not going to be totally.
So if you come in when you're 30 years old and you're starting to get your first line, like I did, I started at 30 and I'm almost 40. I had a little mini line, started tox, and it was gone. Well, when I start people who have deeper lines at rest, which are called static lines, then those will soften over time. So with retreatment, she continues to get it. They're going to soften, sometimes to the point where you don't see them at all. Other times you might see a little faded line. You have to use other modalities, skincare, possibly laser treatment, thing like that. But I think we've got her at the point where she's still young enough, because you're only 42.
Yes.
Where if we keep retreating, that we'll be able to pretty much get rid of them.
And I naturally have a large forehead, and
she gets a lot of units.
And I dieted for so many years. There was a lot to do with skin elasticity and wrinkles as well. So some of it's genetic, some of it's lifestyle.
Right.
I don't smoke or anything like that, so that's good. And healthy lifestyle.
And also skincare. So because you're so sensitive to literally everything, she uses like.
I can't use even vitamin C.
Right, on her skin. So vitamin C, retinols are going to help build collagen and everything else, and also help to make the tox even more worth it and start to fill in with collagen. In all of these areas, she can't really use any of those things. Literally cannot use them. So
I use one what brand you?
Obagi.
I got that a little bit, and then I just use like a natural apricot oil on my face right now. But we're gonna kind of add to that as I go along. So this is my whole skincare.
Yes, and tox is maybe 20%. Skincare's 80%.
Yep.
So
she guides me through that too.
All those different things like that, because it's gonna help with all the lines as well, and if you had discoloration as well.
And nutrition, water, stay hydrated, that kind of thing, so you don't have to worry about
One thing I don't do.
Yeah. You're getting good. So that's so we're just kind of taking you along this journey, and then she'll kind of go through what she's going to go put in the second time. So this is the second time tox for me, and
this time we're going to dilute.
Oh, I wanted to share too, she said another thing, you can take zinc as a supplement.
Yep. 4 days, usually I think it's 100 milligrams. I think it comes in 50s.
Yeah. So
do 100 milligrams you normally take zinc, but 4 days before your treatment every single day. And they're starting to see that can help tox last up to 30% longer if you're someone who eats through it a lot quicker. But
just something
we're
else
just gonna
extra.
add, and what we're gonna do is we're gonna decrease or dilution the saline that we put in with the tox and add a few more units in every single spot to see, because with tox, dose equals duration. So before we do 2 units in every spot, we're going to do a little bit more, and hopefully that will help with longevity. It doesn't necessarily make you freeze more, but it's going to help with the length of how long the tox lasts.
Okay,
Yep.
Got it. Okay, so she's going to kind of put where we're going to put it, and then we'll speed up the video while you do that, and then we'll talk after.
Right.
Okay, so just show where are you going to put this? Let's put this forward a little bit.
Okay.
We forgot the microphone, so we're doing our best.
We're so good at the edit stuff. I'm not. Okay, wait. I wanted you to crunch down. Let's see if you. Oh, your little guys.
My little
So
bunnies.
we like to treat her nasalis muscle. Mother trucker.
So those are my little bunny lines. And I actually told her that I didn't know I liked that little part of my nose until she treated it. I was like, it's so cute.
So you don't? Do you want it frozen?
No,
Okay.
how it looked.
We like to. Yeah, we like to freeze it.
Mhm.
So when she crunches down, she gets lines on the sides. So I like to treat those. Also, when you knock out this muscle, the corrugator and procerus muscles, they normally pull down. So when you paralyze them, it kind of pulls up and outward. So when you knock this muscle out, other muscles around it will recruit. So they're like, oh, okay, well, you paralyzed this one, so we're going to go hyperactive. So she already has those when she smiles, so I also treat those as well. And then crunch down. That's gotten a lot weaker.
Mm-hmm.
Just more nerve-wracking.
So I do, and
Stuff. I'm not. Okay, wait. I wanted you to crunch down. Let's see if you. Oh, your little guys.
my little
So we like to
bunnies.
treat her nasalis muscle. Mother trucker.
So those are my little bunny lines. And I actually told her that I didn't know I liked that little part of my nose until she treated it. I was like, it's so cute.
So you don't? Do you want it frozen? Okay.
How it looked.
We like to. Yeah, we like to freeze it.
Mhm.
So when she crunches down, she gets lines on the sides. So I like to treat those. Also, when you knock out this muscle, the corrugator and procerus muscles, they normally pull down. So when you paralyze them, it kind of pulls up and outward. So when you knock this muscle out, other muscles around it will recruit. So they're like, oh, okay, well, you paralyzed this one, so we're going to go hyperactive. So she already has those when she smiles, so I also treat those as well. And then crunch down. That's gotten a lot weaker.
Mm-hmm.
Just more nerve-wracking.
So I do, and like she said, even I don't have as much movement as I did,
No.
even because I could move a lot more. But I did notice it took about a couple of weeks for me to not wake up. Well, I would say 8 days for me to not wake up and say, oh my gosh, I had some toxin in my face, because I'm so sensitive to things. I could feel it. I almost felt like a mask over me. But then it took about, I would say, almost up to 2 weeks for the very last bit of one side of my face to feel,
which is typical anyway. And even with,
and it didn't hurt. I'm just saying, like, I could physically kind of feel that it was in there, it was working, and then I didn't feel it after that at all.
And also during that point, even up to 21 days, people who get tox, a lot of times, maybe their brow is a little bit higher than the other. Maybe something so everything is placed evenly on around the forehead and upper face, but muscles, it paralyzes the muscles, so they don't always paralyze at the same rate. So you might notice at 7 days you might have a little spot that's still moving. Let it settle in over 2 weeks to 21 days. Usually if you
don't freak out, don't freak out. Yeah.
Or if one eyebrow is a little bit higher than the other at first, let everything settle in. Don't run back to the person and at 4 days, because this kicks in between 2 to 3 days. Don't come back to the injector and say, why is my eyebrow? Something must be wrong. Let everything settle in over 2 to 3 weeks.
Yeah.
Don't bug me.
Yeah.
I'm joking.
And don't take ibuprofen.
Don't take ibuprofen. What are other things? Really,
Stay hydrated. I like to make sure that I was hydrated, just like I feel like any other procedure.
the biggest things that would make you where you don't would be red flags to tox. Obviously, a tox allergy.
Yeah.
Don't
If you
take
have a
something
known
you're allergic
allergy,
to.
don't take it.
Blood thinners. Also, any kind
It would be
of
like a fish oil as well.
muscular disorders like MS, things like that, you're not going to inject people. Those are all kind of red flags. Make sure, I mean, you can still inject, just expect that you might have a bruise, you might bleed a little longer, somebody might need to hold pressure on the injection sites longer if you had ibuprofen within the last 24 hours, or if you went out and you drank an entire bottle of vodka, also thins the blood. I've had people that have come in for their lips, and God love her, but she came in hungover because she had drank all night long and then came in and we did lips. So she had a little extra bruising. It wasn't a complete contraindication, but I explained that with her, that you're going to have more bruising than somebody else because...
And if you typically bruise easier, then you're going to bruise.
Exactly. All right, so I feel like...
you can get, and I'll just move whatever I need to move.
And then lift. Let's get this out of the way. Okay. Let's get that whole forehead in there.
It's a 5 head.
Okay.
Lift up.
You know, because our dilution is a little bit smaller, the spread of the toxin is going to be far. That's another thing. So if you add more, if you dilute with a higher amount of saline into the vial, your spread is larger. So with the dilution, we've decreased the dilution or increasing the units, the spread. So I'm feeling a little more comfortable because we didn't want to, this was our first time tox last time. Some things, if you are getting lines this close down, unless you want your brow and your butthole, then we don't chase lines, okay? But we were kind of safe. We played a little safe up here because as it spread, I was worried about her feeling like she was heavy. We're gonna, because our spread is gonna be smaller, I might try to go a little bit lower on your forehead this time too.
Okay. Whatever you think. I just don't want my brows to be sad.
I'm marking her to see where I'm gonna put my toxin in the frontalis. I like to treat the whole thing. Another thing, a difference between men and women, men are used to having a more furrowed lower brow. Women like their brow lifts. They like when they put on makeup for this not to drop down like that. Women notice this way more than men do.
Oh yeah.
So
I was extremely happy with how my eyebrows ended up.
Good.
Last time.
You didn't feel heavy.
I didn't feel heavy.
You felt the tox, but you didn't feel like...
I felt heavy at first for a minute, but it was all new, so I didn't really know
how it was gonna.
Yeah.
But you never felt like your eyebrows were like you couldn't open your eyes.
No.
Well, if we go really, really far over on a woman and treat the whole entire frontalis, like we like to treat the whole thing, but if we're putting too many units here, women feel like they become way more heavy. Men don't notice it, and you can treat more of the frontalis on men, I found, because they don't notice heaviness in brows. They don't notice if they don't have an arch to their brow anymore because they never cared in the first place, and most men, just bone structure wise, don't have an arch to their brow. So I try to stay within the lines, and then I try not to go put too many units. I like to keep my injection points farther in this way than treating a bunch of spots this way and making her feel like she lost her brow. So, all right, lift. So she starts about right here. What I like to, I'm gonna go a little lower, is spacing them out a little farther. And no one is the same. No one.
And this is why I think it's important to have somebody like Ashley that really understands the face structure. Not that all injectors don't understand to some extent, but obviously I'm very careful on, you want me to do that?
Yeah. Who
would do this. But I feel like it's important to know like exactly what you're doing and the results you're looking for. Also, I think this is just my own personal opinion and how I feel about most things, including coaching or hair or anything, is to stay with the same person as long as you had good results the first time. Because don't you think you get to kind of know somebody's face?
Oh, for sure.
And what they want, and it's easier.
What they like.
All right, so this is after, Ashley, you can come over here so you can see
Ooh.
our little pokes.
You're not too bubbly.
No. And so what can happen, like, if people get, like, what do they get, like, if they get those little bubbles, what is that?
So it's just the product within the muscle, and it's going to be usually swelling. I look awful.
You do not.
Usually, the bumps are gone by the time you get home. So if you if you live 10 minutes away, the bumps are already gone by then.
Oh my God, just a little bit of blood there. So last time I didn't bruise at all. I think I had like a slight, tiny little bruise for like a day.
Little baby for a day.
Yeah.
And you can bruise. That's the main thing that can happen is bruising. Usually if it's going to happen, it happens around the eye area. But I think
did we do 2?
So what I did for you this time is because you felt like you were a little bit over. You like the little line kind of a little bit under your eye. So I dosed her 2 and for a brow lift, and then what I saw somebody else do that said that it can kind of make some of the skin hang a little is that they dose at 4 in a couple areas right there at the outer canthus. And so it kind of goes like this, and then one little guy at a 2 unit. So everything's kind of patient specific. Like they say 4 units, whatever. She didn't like feeling like this skin was hanging because she had the units around there. She kind of likes a little bit of expression under her eye. So I kind of just
felt like
tailored
it was too, so that was like, that's the
so we're
important
tailoring
part
it this time.
about staying with the same person
Because they know you.
And then what else was I going to ask you about? Oh, so how many units is this? Tell the public.
Oh God.
So, I want to talk about, she talked about this. She treats the face, so section by section. So you would never come in and somebody be like, give me 20 units, because you'd be like, I don't even understand what that means.
Or my friend gets 30, but they never treat between my eyes. For one, if they're not treating between your eyes and treating your forehead, run. Yeah. Because this muscle pulls down, so when you paralyze it, it lifts up a little bit. This one lifts. Obviously, that's how we get wrinkles. It's expressive, and when we paralyze it, it goes down. So the counterpole of it, if you were just to treat lines up here, then your eyebrows again are in your butthole, and then this muscle around the eye, the orbicularis. This is a round muscle. I like to call it a sphincter. Because people like to know that they have sphincters on their face. They have one around their mouth. They have one around their eyes, and they have one on the south. So we paralyzed her sphincter, and so. But I'm hoping with more injection points. I think last time, because she has a larger forehead. Larger foreheads usually need more units. I've done the typical is 12 to 20. I want to say that I put like 38 in her forehead.
Today.
Yes. Yeah. I did like 34 last time, almost. So we did more pokes this time, more units in each spot, a smaller spread, hoping that it'll last longer on her.
And she likes, like I wanted to point out, you like to treat sections, and it made sense to me. Like somebody doesn't want to come in and say, go just treat my forehead, but she wants to make the whole face complete.
Or the biggest thing that you can do for an injector, and I hate to say it's about money because honestly, Tox does not make us that much money. But they come in and they say, I have $200. What can you do? I can treat between your eyes. Yeah. So here in Michigan, it's a lot. I mean, at our spot, it's $11 a unit. So you're figuring $220 just to go between your eyes. Yeah. Or can you just kind of spread it out? No.
It wouldn't make sense.
Try, and I hate to say it, but try to save.
To get the full effect.
To get the full effect, because if you're not if you're just treating between the eyes and the forehead, and you're not treating the crow's feet, then you're gonna look a little disconjointed. That's when things look unnatural, because you have a million lines around your eyes and under your eyes, but your whole forehead is frozen. So try to save up for, guesstimate that you could be getting 60 units during your treatment, and plan accordingly, because it's really hard for injectors, to get that full effect and the desired effect when you give them a really small budget or say, this is all I have. Okay, what can you do? oh, can't do much.
And it would be, so her point is, it would be better to save up to get the full thing, so you can get the look that you want.
Yes.
And then you can see how long it lasts and come back. And I know what was the average, like every 3 to 6 months eventually.
It's going to always be 3 to 4 with tox. Now I say with filler too, you know, I don't mind a budget, but anticipate if you're wanting cheekbones, you're wanting this, that, and the other. We're going to talk about full face assessment with her. She doesn't. But if you're anticipating $700 a syringe. A syringe is the size of a blueberry, so we can do a syringe, one side with one syringe, another side with another syringe. Honestly, to look fake, these people are so scared of looking fake. Depending on your age and how much volume you lost, you can anticipate seven. I mean, honestly, look at this face. And I have 15 syringes total between my jawline and everything else.
Yeah.
And I still don't look scary and...
Right. Fake.
Because you figure one syringe is the size of a blueberry and you're putting it deep down onto bone and pumping up cheeks. Just to do cheeks and the lateral zygoma, like your cheekbone, is 4 syringes. Yeah. So if you're coming in and you're like, be prepared to pay. We, here at our place, Pure Bliss Salon and Spa in Flint, we have cherry financing. A lot of places do have financing that helps you to pay it off with 0% interest over 6 months or a little bit more interest over a longer period of time. Almost like is it care credit?
Yeah, like care credit.
Like a care credit.
Yeah.
But if you're wanting a desired effect and you really trust your injector and you want this and that, I mean,
it would be worth it.
Safe injectors. I mean, I don't price gouge, but you know, if you're
yeah. So basically, you're going to get a lot of what you pay for, and you want to make sure that when you're going into something like this, that you save up, and that would be the best thing to do, is just save up for the look that you want, and understand that it's kind of in it for the long haul.
Yes, that you're not just going to do, that you're not just going to do a one and done. Yeah, you might look good for 3 months, but you have to do continued use, just like anything. Like Pam's an exercise guru. I mean, I call her a guru. She's an exercise guru. Would she ever tell somebody that you need to work out for 3 months and then never work out again? No, you'd lose all your your muscles.
And
you lose all your endurance. You do it forever. So when you're ready, you know, be anticipating, and everybody spends their money where they want to spend it, whether it's nails twice a month and
or hair
or whatever. So I never pressure anybody into anything, but if you're going to start the journey and you want of anti-aging, you have to be willing to keep it up and anticipate toxin treatment every 3 months is what I would budget for. So
yeah. And she said too that these muscles will get less and less as I go along. Yeah. And which we did kind of notice as I came in. They didn't have as much movement. But I will say, like, when I noticed, I was like, oh, I noticed it a little bit, and then it was just like, wow, I noticed it's almost like, okay, it's time. I messaged her.
Yep.
And I did get really used to the look with it out. So I was like, okay, it's time to go.
I know. Mine is like, it all falls at one time. It's like the ice in a cup.
Yeah. Like
you want to get a couple of cubes out, and then so like you hit the 3 months, and for me, I hit 3.5, and I go, and look like an old lady again. Yeah. But guesstimate 3 to 4.
Yeah, and also understand that this is something that Ashley is passionate about.
Yes.
And just like I'm passionate about exercise and making sure it's for your health. And it comes from a place from her heart of no judgment. So it's like if I never came in, she would still be one of my best friends, and she'd be like, it's fine, like whatever.
You want tox, you don't want tox, I don't care.
And she can still kind of consult you and say, hey, this is what we could do, this is how you could get this look, but if not, here's some skincare tips, and you can go that route first.
I'm not a salesperson.
Yeah.
I just love, if I didn't make, I mean, I hate to say that, but honestly, if I didn't make a nickel off this, I would still be doing it because I have such a passion for it. So look for people that really, really care. A good thing is also everybody's on Instagram nowadays, but looking for really good results. And then if somebody swears by an injector, going to those kind of places, a lot of people pop up. A lot of people don't do continuing ed. Make sure that your injector does continuing ed, does cadaver labs, studies anatomy, is available to you afterwards, doesn't just inject and then never check up on you again. Make sure that if red flags would be that if you asked what tox they were using and to show you the packaging, that they'd be able to show you and make sure that it wasn't imported from somewhere it shouldn't be.
Yeah.
Same thing with filler. You should be able to, you know, be able, people should be able to show you and go through steps.
And know their product.
Safe, good injectors do that.
So. Yeah, awesome. Thanks.